Hi, everyone. Can everyone hear me?
Yes.
Yes. Okay. So welcome to this talk, a Street Vision talk. My name is Geetha Gopalan. I'm an associate professor here at the Silverman School of Social Work. And today I'm going to talk about a research project that focused on thinking outside the box of the typical way child welfare and child mental health services are here in the United States. And so, as you can guess from the title, this work involved collaboration with lots of different partners, researchers, child welfare professionals, but also, most importantly, parents who have the lived experience being involved in child welfare services. And along this journey, and it was a journey, I learned a lot of lessons that I'm going to share with you today in the hopes that it can inspire you all to try something new and think outside the box. So first I want to start with, when we think about child welfare, typically we think about children being placed into foster care. But what if I were to tell you that the majority of families were investigated for allegations of child maltreatment, their children actually stay at home after the investigation? And because many of them are struggling with a number of different stressors, often sometimes occurring at the same time, they continue to receive services from the child welfare system that are designed to keep their kids at home, prevent them from entering foster care. One of those stresses is that their children tend to manifest really high rates of difficulties in managing their behavior. So they get into fights at school or with their siblings and talk back to their parents and teachers. They stay out, they pass curfew, or they cut school, they steal, they lie. And the reason I'm really concerned about these issues is because I know that if these issues go on unaddressed, they'll increase the likelihood for future maltreatment, as well as kids being placed into foster care. So it's really important that families that are already really struggling also get access to effective child mental health treatment to address these behavioral difficulties. But unfortunately, our systems are not responsive to the needs of families. So what usually happens is that child welfare services can refer families to the public mental health system to get services for their children. But there's not enough mental health providers to go around. And so it's not uncommon for families to have to wait up to 6 months to get an appointment. And even if they do show up for that appointment, the public mental health system does a really bad job of engaging and retaining families in mental health services. And then finally, there's no guarantee that any of the services they receive in public mental health are actually effective at addressing children's behavioral difficulties. So my big idea that I was able to get funding for was, what if we could integrate evidence-based mental health treatment for children that addresses child behavioral difficulties in the same setting where families are already receiving services designed to prevent out-of-home placement. In this way, this could be a one-stop shop for families where they could get services that are designed to keep their kids out of foster care, while also getting services that are designed to address these behavioral difficulties in the same place. And I was really interested in focusing on one particular model. This is a multiple family group model designed to reduce child behavioral difficulties. It prioritizes engagement, meaning at each session, childcare, meals, and transportation are offered to families, so we overcome some typical utilization barriers. And it's designed as a series of weekly meetings held over 4 months, where 6 to 8 families come together, and the content focuses on common elements of effective evidence-based treatments that address child behavioral difficulties. Now, having worked with this model for many years, both as a clinician and as a researcher, I know that it's effective at reducing child behavior difficulties, but it's also been shown effective to reduce caregiver stress and depression. But it's never been tested outside of the child mental health system or delivered with people that don't have advanced mental health specialization. So the first part of my study was listening to child welfare staff as well as parents who are affected by child welfare services. So over the course of 6 months, my research staff and I convened a collaborative advisory board where we talked with child welfare staff and caregivers about how this multiple family group model needed to be modified so that it could be delivered by child welfare caseworkers in preventative services. What we needed to do in terms of training and supervising the child welfare caseworkers, and what supports are needed so that caseworkers could actually deliver this multiple family group model while also attending to all the other things that they do. So, for example, one of the modifications is we actually reduced the length of the intervention because the caseworker was like, I'm not delivering a long intervention. So it was brought down to a little over 2 months. We added content on mindfulness at each session because we knew the families that would be participating in these groups, they're going through a lot of stress. And we also strongly recommended that if caseworkers are going to deliver it, their caseload should be reduced, at least temporarily, while they're delivering this model. So I was all ready to do this in New York City. I had an agency picked out, I had a plan, go, and then I went to get the approvals to move forward. But I ran into a number of regulatory barriers, so much so that I actually ended up having to move my study to Maryland, where I started off as a baby assistant professor. And I hit the ground running, talking to anyone and everyone who would listen to me about how can I get this project done? How can I get this project done? So one of my colleagues, she connected me to her sorority sister, who actually happened to be the head of child welfare services in Maryland. And that sorority sister connected me to a county-run family preservation service. Again, this is a child welfare agency that provides services to families who've been investigated for maltreatment. Kids are home, but they're providing services to keep the kids at home. And so at the end of the day, we were actually able to implement these multifamily groups at this agency. Our Rosie, the Riveter over there, was our program manager. She was awesome. She helped us make sure that caseloads were reduced and that we coordinated resources for families. And so we were able to deliver 3 groups with 12 families who were receiving services, family preservation services, and who had a child between the age of 6 to 13 that also had clinically significant behavioral difficulties. And then after each group, we talked to the caregivers and the child welfare staff, the caseworkers delivering it, their supervisors, as well as their administrators about what worked and what didn't work. So what worked is that the caseworkers were actually able to deliver the intervention with fidelity. We're very excited about that. What also worked is that the child welfare staff and the caregivers, they liked the model. Like the families liked being there with other families and hearing that people shared the same problems that they had. The child welfare staff and the caregivers also felt that the model really addressed an important need. But what didn't work was that a lot of our families still couldn't attend the sessions. We provided meals, we provided childcare, we paid for their car fare, but they had so much going on that attendance was really poor. We also knew that there were a lot of families who didn't meet our eligibility criteria. Either their kids were too old or too young, or they may not have met clinically significant behavioral difficulties. And then there's the power dynamics in child welfare. Now, mind you, when I went into this study, I first off was telling the child welfare staff and families it's voluntary. Did I say voluntary? Voluntary. Families should be able to participate if they want to. There should be no repercussions if they don't. It should not affect their case. We even developed a letter that said so they could take it with them. That said, at least one caregiver told us, no, even knowing it was voluntary, she felt obligated to show up because her caseworker facilitated the groups. And another caregiver told us that she wished this group had been offered before she was ever investigated for child welfare services. So this got me to thinking about what are my next steps. And I really wanted to make sure that this multiple family group model could stay at this family preservation agency. But we knew some things had to change. So I convened another collaborative advisory group of child welfare staff and caregivers in Maryland. And we went through the intervention materials and came up with a set of recommendations. And then my research staff and I developed train-the-trainer materials so that the agency could train and supervise their own staff without me or my staff being involved. And then we left. And so the new model is called Families Supporting Families. Still multiple family groups, but one of the big modifications Families didn't need to have a child welfare case to be involved. It was open to any family in the county, regardless of your child's age, and there was no pre-eligibility criteria on meeting a behavioral disorder. Another big change is it was offered outside a formal child welfare setting. So it was offered in the local libraries, in community centers, and when COVID-19 lockdown hit, it was offered on Zoom. And over a period of 4 years, we learned that this family preservation service was able to deliver 7 cohorts, 7 groups, and serve 41 families. So what did I learn from all of this? Number one lesson is tenacity matters. Or as one of my mentors always says, all's well that ends. So this work is really messy and super challenging. And a number of doors slammed shut in my face. And I learned I had to stay committed to creative problem solving and just be as persistent as possible. The second lesson I learned is get political capital. I can't tell you how important it was to talk to that sorority sister. She made my day and really changed the course of this project. But it underscored for me the importance of taking advantage of opportunities to meet people that have influence, both in the community, but also in the service systems that I want to work in. Lesson number 3, turnover happens. So while we were able to implement those 3 cohorts of groups, we still had to make some changes in between those groups. And that required going back to the institutional review boards at the university, as well as at the state. And remember that sorority sister I talked about? She left. So I had to explain my project to a whole new group of people and ultimately got it approved to move forward, but it took about 5 months just to get that done. So the lesson I take home is that I have to be prepared to orient new stakeholders on a continual basis in order to sustain knowledge and momentum. Lesson number 4, beware of the culture of compliance. So even though I could speak over and over again, voluntary until my face turned blue, that culture of compliance in child welfare where caseworkers are used to telling parents what to do or else your child will get removed or else your child won't come home, that still pervades child welfare services. And so for me, that meant if I were going to continue to work in formal child welfare, I needed to make sure that I have lots of conversations with my partners up front so that families don't feel coerced or even obligated to show up. And ultimately, what I decided is I'm going to work outside of the formal child welfare system, but thinking about child welfare writ large, those communities, organizations where you don't need a case or an investigation to get services, but that are designed to support families. Lesson number 5, understand the regulatory landscape. I learned this the hard way. And so the lesson that I take home, particularly as I continue this work, and I've already got a call set up with Anna to talk about this, is what are the regulatory barriers that could get in the way of me doing this project? What do I don't know? What do I need to know that I don't know already? And leveraging the resources that I have available, either the university's legal resources, or I'm actually looking at Vicki right now. Vicki, you're going to be my legal resource. How can we identify those barriers and how can we navigate around them? And then the final lesson, because it takes a village. I could not do any of this work by myself. I needed the help of other researchers to help me even get funding for the grant. I needed help from child welfare professionals and parents with a lived child welfare experience to really think through how to best implement this. I needed the help of that program manager, that Rosie DeRiveter, to actually implement it, and that sorority sister to get me connected to this work. But most importantly, I feel like I needed the help and to be educated by parents who are affected by child welfare systems so that I could really understand their complex relationship with the service system. And so in conclusion, I hope I haven't scared anyone off. I hope that this inspires you to try something new and to build your own village of stakeholders who can guide you, support you, and educate you along the process.